Thank you for joining us on another episode of the Multipliers Podcast. My name is Mehdi and I'll be your host for today, and it is my pleasure to introduce our esteemed guest, Dr. Jun Wang, founder and CEO of iCarbonX, where we will discuss a wide range of topics around health tech, artificial intelligence, genomic, and personalized healthcare. Dr. Wang, thank you for joining me today.
Thank you. Thank you for having me. Oh, it's my pleasure. Pleasure is all mine. Yeah.
Can you please tell us a bit about yourself?
Well, my name is Jun Wang. So in China, it's reverse. We call Wang Jun. Yeah. I'm a geneticist from training. Actually, I was trained in Peking University as mathematics, computing science, and biology background. I co-founded BGI back to 25 years ago. 10 years ago, I left the company and I started my second company called iCarbonX. So I'm a scientist and an entrepreneur in a way. Yeah.
What is iCarbonX?
Well, as you can see from the name, right? So iCarbonX, they have three basic assumptions there. So life could be digitalized, life could be computed, and digital life could be networking. So that's the three assumptions. If you can see from the name there. Yeah. So the company is built based on the digital life and artificial intelligence technology to do personalized or precision healthcare. So that's the vision of the company.
What is personalized and precision healthcare?
Well, if you look at the world healthcare system right now, there is actually three basic trends in the field. Well, in a way, because it's kind of a little twisty situation right now for the players in the healthcare system. If you look at the government, so they want to, their medical care expense, or if you look at the percentage of the GDP is growing every year, so it's growing fast. But for hospitals and doctors, in China, the hospital in a way is profit-driven sometimes. So they sort of value themselves as how many beds they have and how many surgeries they've done. But for the ordinary people, so they want to live longer, healthier, but they also want to spend the money on healthcare less. So they are not always aligned if you look at all their hopes. So in a way, there is three trends on the field to solve the problem. So the first of all is preventive care.
Yes.
So you cannot simply, spend all your money on ICU when you get very, very sick. You want to predict your disease or do early diagnosis of your disease, make sure you can treat them before it getting worse, right? So that's the first trend. The second trend would be more precision medical care or healthcare, right? If you're thinking about, for example, diabetes, there is at least hundreds of different subtypes of diabetes. What kind of diabetes you have, right? So it probably affect the treatment or the intervention
really
in the future.
Because I'm pre-diabetic myself.
Well, you see,
this is the first time that I hear that there are 100 different types of
Well, thinking about let's say the glucose level of your body there. It will be affected by many things. It's a multifactorial, nonlinear correlation. So you have your genetics, you have your diets, you have your stress, you have your gut bacteria, you have your exercises, you have sleep pattern. So you have all the factors which are probably have some effects of your glucose level there. So it's not like a linear thing, right? So you can correct the one thing, then you got a better results there. So it's like a modeling. So that's why AI and deep learning technology become very essential here, right? So you try to model yourself, you try to understand all the factors there, build a model, then you can control your glucose level. So you don't know if it's for you, if it's how to say the factors and how that affects your health there. A previous study on 800 people, even eating one banana, the same banana, maybe my glucose level going up and you're going down, right? So it's
the same banana.
It's the same banana. So that one single factors, totally different results into different human body there. So we want to understand it. And to understand that, you need to digitalize all the information there, right? So you need to understand your genetics, you need to understand your diets, you need to what kind of proteins, antibodies in your body, how your body react to the environment, and all them together, you need a model to basically predict how those factors could change your glucose level, for example. So to fulfill that, I mean, as I said, the precision healthcare there. Is the second trend, which is very important there. And the third trend would be the patient participation. Right now, the doctor has a power basically to tell you what to do. And now people are seeking for a third opinion. So they want to, especially if they got a cancer, for example. So they want a third opinion of how it should be treated and so on. But in the future, I think with the help of artificial intelligence and all the modern tools and testing tools and so on, the patient itself should learn themselves more. So they want to manage their own health by discussion with the professionals. So they will be more and more involved on the process of treating yourself. So that trend also kind of inevitable. So it's very necessary. So in order to have those three trends like preventive care, precision care, and patient participation, with all those kind of three trends happening, you need key technology or core technology to make it happen. The two basic pillars of that, what we call, or I call, the first one we call digital life or digital me technology.
Digital me.
Could you transfer all your information from this carbon-based body to a silicon-based avatar? You understand what I mean, right?
So you were going to create a silicon-based avatar.
Yeah, well, you get one drop of the blood, or you get your blood sample there. So you read all the information of your blood sample. You got your fecal sample or saliva sample. So you read everything there. So you basically convert all those information, what kind of protein, antibody, or reactomes on your body or genetics, then convert it into a silicon-based language there, right? So then based on that and deep learning modeling technology, you're building your own avatar.
So how many markers would it read?
Well, I don't think...
it's not about markers?
I don't think we should think as a diagnosis marker or biomarker thing. I think we should think as a profiling. So the entire information of your human body, like your whole genome, the whole information of the DNA, RNA, protein, antibodies, gut bacteria, everything. Because you don't know which one is relevant, right? So you basically digitalize every information there, put it there, they're using artificial intelligence to do computing, to do modeling. And then you do self-training, right? For example, if you have all those glucose level testing on your arm, then you record or everything that you've done, right? So then you do blood sample testing. You also do what you're eating, how you sleep, and all these things there. So you see your changes of glucose level. So that kind of feedback loop is actually training your own AI, right? So the digital you or digital me will become more and more alike to myself. So then in the future, you could basically using the model to manage your own health, because you can at the same time. I mean, time is not reversal, right? So at the same time, if I drink coffee or orange juice or water, how that affects my glucose level? You cannot do that at the same time, but your digital you, your avatar could do. They will tell you how that changes affect your life. And then you can choose whatever you want it to be and do it in your carbon-based life. And then, so that kind of feedback loop is very, very important for the three trends I just talked to you. That model basically helping you to do preventive care, because it could do more prediction or early diagnosis there. They could do more precision medicine. They could also making yourself understand more about yourself. So knowing yourself is the first step to manage yourself, right? So
Yes.
that is the key in a way for the future. And iCarbon X, as you can see from the name, so we are building those two technology pillars, the two supporting arm, basically, of the next generation healthcare system. And we should build the technology, not just doing it in a very expensive way, like, I need $1 million to do one-time testing or digitalization of my own carbon-based information. That's too expensive. We need to do it like, $10 or even $1. So by that, then you can really, become, let's say, a business, right? So otherwise everybody could do it, right? So not just business, but also everybody could do it, could have the technology if it's cost efficient. So,
I mean, it sounds like science fiction, but it's not, because you actually are doing it right now.
well, we were having more than 1 million users or members in US.
In the United States.
United States, yeah. Back to almost 5, 6, 7 years ago. But then, the tension between China and the US. Now we are doing it in China. We are, my little hometown is 1 million people there. So we started to withdraw sample from them and doing the same idea and same thing in the little town there, 1 million people.
And what are the kind of results that you're seeing from this?
Well, again, so this is the first step, right?
So,
So you need to digitalize them, modeling them, and stratify the population to high risk of certain disease or early diagnosis of certain disease. Then you know how to deal with it, right? So you need to develop or more and more precision care or more and more treatment are based on the information you can achieve or you can get. So that's how we are. Yeah.
Are there any limitations with the technology that we have nowadays, or?
You mean limitation regarding to the cost? Or
Exactly. Yeah.
well, there is, right? So, for example, to sample yourself still costs money, right? So
Yes, of course.
At a point, testing yourself is cheaper than sample yourself, for example. Yeah, but there is a limitation there. But I think it's for public healthcare use, it could be cheap enough or or very cost effective to do this.
And data privacy is always something that people are thinking about when it comes to sharing just their information in general. But now we're talking about even having a digital you, and having your DNA on a database somewhere. So how would you ensure that people's private data is private, their DNA, so on and so forth?
It's not me to ensure that because I don't touch data at all. So we just provide the technology arm. So for example, if I work with any organization in UAE,
Yes.
It's the organization, either it's a government organization or private company. They host the data, manage the data, and do everything there. But we just provide the technology and the AI and testing technology as a tool
Right.
for them. Yeah.
Okay.
Well, for example, in China, is the local government hosts the data and biobank
That
and
will have
everything.
the data. Yeah. Okay. That makes sense.
Yeah, but we are a technology platform.
Yeah. What would you say is the future of preventative healthcare, and how is it going to keep on evolving?
Well, I think everybody should has its own avatar. Everybody should has its own digital me.
Okay.
And you should know yourself better. Then you can start to understand and manage yourself. So that trend is moving very fast. With the technology we developing, make it cheaper and more accurate and cost effective, robust. Then people could start to learn more about themselves and
Is there somebody else out there doing this, or are you unique in this?
Well, the concept I mentioned back to almost 10 years ago, I believe lots of people are trying to do things based on those concepts there. But so far, to really measure or profile everything on your blood in a very, very cheap manner, I think we are the only one in the world.
You're the only ones doing it. And when it comes to future collaborations or partnerships, what do you think? Who do you think will be important for the success and the growth of the company?
Well, as I said, there are several players on the systems who urgently need to change the current situation. The government wants their people to have more cost-efficient healthcare system, spend less money, but people live longer and happier, healthier. The hospital needs to understand more about the patient and disease and making the right diagnosis and treatment to the patients. And patient itself wants to manage themselves better and spend less and live longer. So I think those players should be all on these systems there. Again, we are just the technology platform there. We are the technical player on these systems there. But it takes time for the government, hospital, doctors, as well as the patient themselves to understand the whole idea and the structure and play their roles basically in the system. So that's why my own hometown, this 1 million people experiment, so the government there understand it. They try to make every players do the right thing in the new system. That's what we call the version 2 healthcare system in the future. Then everybody could get benefit out of it.
Yeah, I mean, instead of giving everybody Ozempic who's overweight,
exactly.
Let's try to treat the cause.
Let's try to, for example, award the preventive care.
Yes.
Right? And if people do right things, let's try to also award them to get more benefits.
Yeah.
Let's award the doctors and hospitals if they have less and less diabetic patients.
Exactly.
And spend less and less money on diabetes. So that kind of awarding system is different with
it's very different.
Right? Yes, very different. But this system could only work if you have the right technology to make it work. Of course, you also need the government, the doctors, hospitals think that way too, right? So we are doing that in my little hometown now.
Maybe that case study can be replicated around the world if it's successful.
Well, I think so. So the WHO just invited the governor there to give a speech in the United Nations building.
Nice.
Last month. So the China National Healthcare Department also recognized it's a really, really important model to expand. So we are doing that. Yeah.
And outside of what iCarbon X is doing, you being an expert in this field, do you think personalized healthcare moving forward is the future as opposed to just the generic healthcare that we're experiencing right now, where if you have high cholesterol, right, so everybody takes the exact same pill, even though your body's going to act differently than somebody else. So.
Well, let's say I co-founded BGI 25 years ago. The company was aiming to develop more cost-efficient sequencing technology. The gene, DNA is just a strategy, a survival strategy, right? A child from a Tibetan population, of course, can adapt to the high altitude. If they don't, they have less chance to produce the offspring. So the natural selection play a role there. So everybody's own genome is their own strategy of survival to the environment. But that doesn't really mean If a Tibetan child living in here, Abu Dhabi, probably their genes for the high altitude diabetes never express because they don't have to. So it's a survival strategy, but it doesn't really mean it leads to the results. So if you have 30% higher risk of diabetes in your genetics, doesn't mean you have diabetes, right? It's like this little box for you to live in, probably smaller than the people have less risk of diabetes. If you live carefully in the lifestyle, you don't have diabetes. But for a person who have less risk genetically, if they, have a not very healthy lifestyle, they may still have diabetes. So in a way, genetics is a strategy of how you react to the environment. But actually, how you react to the environment relies on how you live, how you make your life choices every day. What do you drink? Do you do exercises? How you sleep? Do you have any stress from walking? All those kind of reaction to the environment and choice you've made make who you are today. So that is, in the future, as I said, why I left the BGI, started the second company, is not just doing sequencing, but actually to understand more about the digital life of you, then try to model it and try to understand it and try to manage it. So there will be more and more medicine or intervention care or more lifestyle changes or whatever will be based on the personalized information and personalized modeling, because we are different. We are similar, but we are also different. So we need to find out the right way to manage yourself. So that's the key there. And don't forget the bacteria, right? You're not just yourself. You have more than thousands of gut bacteria there. I published the first gene catalog of the gut bacteria paper in Nature back to 14 years ago. It's still cited as one of the most cited paper in China. So you have lots of, bacteria, bugs on your, so you're actually having second-hand food, right? Because they are having the first hand, and you have the second hand. So
can you explain how important the gut bacteria is to the immunity system?
Well, any food you eat, so they try to digest it first for you, basically. With millions of years evolution, those bacteria knows how to work with you to provide a right metabolic, consequence there. Of course, if it went wrong, you have issues there. Not just the diarrhea and the imbalanced bacteria gives you diabetes, for example. And a lot of metabolic disorders are because of the bacteria imbalance in there. So there's a huge way of doing that. It's actually not just the gut bacteria, but also the skin bacteria too, right? The modern humans now, probably from the past 300 years or 500 years there, we using soap, right? As all these modern hygienes actually kill the bugs, the good bugs on your bacteria. One of the bugs were killed called AOB, the ammonium oxidation bacteria. That bacteria convert the nitrogen, which you eat lots of meat and you produce the nitrogen. They convert the nitrogen to nitrogen oxides, which is very important for the nitrogen cycles of your home building. They sort of co-evolved with you for many years, right? If you look at all the mammalian, they all has that bacteria on their skin. So for the horse, they just the bacteria was on the mud, right? So the horse taking shower on the mud in that way. So they have all the bacteria on their skin there, but we do not, because of the modern human using lots of those hygiene products there, and creating issues on the skin. Because the anti-inflammation of those bacteria are very, very, very powerful and very useful. If you don't have that bacteria, you develop, for example, asthma, acne, you itching, and all those, the skin become very sensitive. So we are, as I this one is a live bacteria there. We developed this as a simple spray. So you can easily put it on your skin, mouth, or eyes. And because it's extremely safe and alive in the environment there. We are now having 3 indications of this one medicine in past already phase 2 in FDA. So now we are in the phase 3 process for the bacteria to develop as AD drug, asthma aging drug, which is a multi-billion-dollar drug in the whole world. So that just gives you one example. If you don't play well with the bacterial world, if you don't have that, which is the good bacteria, you develop disease, right? So if you have that back, they kill the disease. So it's not just yourself, but also you need to consider the microenvironment of, the bacteria.
So this is the good bacteria.
This is a live bacteria.
You're reintroducing it into your body.
Yes.
Okay.
You introduce back your body. Yes. As a drug,
it's fascinating,
and it has very good results, and it's extremely safe.
Yeah, so. Because normally you take a probiotic,
Yeah.
So this is
for the gut bacteria it's the same, right? So people are using FMT, fecal transplantation right now to cure disease. If you have your gut bacteria issues there, they transfer a healthy gut bacteria as a group to you, then the disease was cured. So it has been FDA approved for for the C. diff infection, for example, the fecal transplantation become a treatment there.
Wow.
So that just tells you that you need to, this is the microenvironment thing that you need to understand more and manage it well. You need to understand yourself from your blood sample. You need to understand more about what food supplement you should eat, what medicine you should eat. We are having another company doing anti-aging.
Okay.
More and more the scientists to treat aging as a disease. So it is a disease that everybody will have eventually, right? The aging. So more and more scientists treat aging as a disease. So if you look at the molecular level of the agent, they have probably 12 different subtypes of agent, including your mitochondrial dysfunction, DNA instability. You may have issues with stem cell generation there. You may have problems with what we call epigenetics. So you all probably have your microbial issues there. So those 12 subtypes, there is no diagnosis tools to do one single test of those. So we are developing, again, a test of, basically stratify which subtype of aging you are having. And then according to that, you give them the right intervention patterns. Right? Either, for example, for fasting, do you need to do fasting? And what is the best fasting patterns you should take? Or do you need to have metformin? Or you have stem cell treatment there, or even gut bacteria transplantation to make you, anti-aging as your own personal aging treatment there. So there's lots of. You need to understand again. The whole concept is you need to understand yourself better. Yourself, your microenvironment, your microenvironment, and how you treat yourself, how you manage yourself, what kind of lifestyle or what kind of food and medicine or any actions you could do to your human body. Then, of course, feed back to your model. Tell them if it changes, by testing, if it changes to the way you hope they are, then the model will become more and more like you.
And how far away are we from this advancement?
No, we already, as I told you, we already launched it in China at the several scenarios there.
No,
for the aging, for
the anti-aging one.
Yeah.
Oh, you already launched it in
Yes,
China.
yes.
Oh, okay,
yes.
sorry.
I have my 8 years data. 48. Do I
But you look 35.
Thank you. So I'm constantly measuring myself about all those things there, and I know the problem of me, and I do interventions. I for example, I have a genetic risk of gout, and right now I have this because of the stress of the work. Probably I have this little inflammation issues there, so I'm dealing with. So there's there's just all those things could be measured and managed right now.
So for a guy like me who's living here in Abu Dhabi, can I have access to this?
Well, that's one of the reasons I'm here, right? So I'm trying to engage to the society here to see if we can bring the technology to here, not just to Abu Dhabi, but also to the UAE, to Middle East, to Europe, to the whole world. And Abu Dhabi could be our international harbor for that. I mean, for the bacterial drug too, right? So that's the reason I'm here to explore the opportunity, not just investment opportunity, but actually to do real manufacturing, because those things needs. So let me show you that array. Do you have that array there? So let me show you the things that we developed to do the digital meat testing. So this is a silicon wafer, silicon-based wafer.
Okay.
On the surface of that basically synthesizes about 200 million peptides on one peptides on this array.
Okay.
So you can cut it to a level that you can the array reader could read.
I don't know if the camera can catch this, but you know how the so on old calculators we used to have these squares that used to grab the energy to give it power.
Yeah, but
do you see the squares? Yeah.
And this one, so you can cut to the format that the array reader could read. So by a square millimeter space, let's say a space of a square millimeter. So what you can do is 20,000 tests.
Sorry?
You can do 20,000 tests.
20,000 tests
at a square millimeter.
Wow.
So at a cost of $1. So that kind of technology is what I'm talking about, right? So you need to process your blood sample from a fingertip. So to basically measure it by this technology there, to digital yourself for your proteins, antibodies, and all the, peptide and protein has this unique binding there. They're very sensitive. So this is a semiconductor industry, is very matured. So the semiconductor business could be scalable, robust. So that's what we are basically integrate both semiconductor, biochemistry all together to build those testing tools. And to answer your question, so we are thinking about to do manufacturing here to make sure, it's robust and cheap and cost effective for, people to do testing.
This is fascinating.
Yeah, well, that's just, that's 10 years
worth
work.
of research.
Yeah.
It looks like a solar panel.
Well, and it's cheap, to do, as I mentioned to you, for the square millimeters, 20,000 tests for one sample, $1.
Wow. So
everybody could afford it.
Wow. That's quite remarkable.
Yeah. So we are in the how to say, big changing time. The government wants change. Hospital doctors wants change. People wants change. So everybody wants a new version 2 healthcare system to come in. It's like AI, right? They have the NVIDIA, the GPU makes the new AI wave. So what could make the second healthcare system wave? And what is the GPU of that? We believe that's the digital meat technology. So they could basically making the second generation of healthcare system wave.
I'm curious. You have been going from success to success, right? From the genomics to this. What drives you?
Well, certainly not money, right? Because I could be retired almost 10 years ago, right? I think it's really, I'm as a scientist, as training, right? I really wanted the new technology to benefit everybody. That's the reason I drive the cost down, right? When I drive BGI, sequencing cost is basically down to the level everybody can afford it. Here too. So I want everybody to have the new technology, advanced technology, to helping them live longer and healthier. This is not just some slogan. This is something I remind myself every day, basically. So this is what your value to the society, basically.
You're giving back to society.
Yeah, well, it's what you can do, right? It's not just that you can think of the idea. You can actually achieve that in your lifetime. And if it's not me to achieve that, it's okay too. But I want it to be me, or to be myself and the company and the group to achieve that first. So just want it so badly in a way, because we know it could be achieved.
We have a tradition towards the end of the podcast where I ask a question, right? And last time I changed the question, and it was, if you can go back and give your 16-year-old an advice, what would it be, right? I don't think you would change much, or would you?
Well, it's just I think people needs to have this self-driven thing, right?
Yeah.
Everybody has its value points, or how they see their value to the society.
Yeah.
If you think human as a species, there's only few people living at the edge. So they either know more from the population point of view, either them know more about the world, about themselves, or they're creating something that nobody else created. So instead of living in the background as a human individual in a population, I prefer living at the edge to try to creating something new or knowing a little more. That's the reason that being a scientist, I want to explore more. And being an entrepreneur, I want to, make something unique and beneficial to the society, that people could enjoy the technology and do it and know themselves a little better, manage themselves a little better. Those things are, so I want to live at the edge. I want to make the society better and make the human being live longer and healthier. This is really what
This is your drive.
This is my drive, deep in my mind, yes.
If Elon Musk was going to go to Mars tomorrow, would you join him?
Well, when I gave the TED Talk, after my talk, Elon Musk is talking about his boring company there.
Yeah.
Well, for me, I think I'm a scientist on biology and AI, so this will be my field. So I will only focus on this.
Okay.
Well, Elon is a wonderful person. I just saw his video of the SpaceX and everything else he's doing. He's also doing Neuralink and a lot of things.
Fascinating.
Yeah, fascinating.
Neuralink, yeah.
But for me, I would rather just focus on
stay on Earth.
My small ideas of digital me avatar and to make people healthier. So that's my that is my goal and my ambition.
Dr. Wang, you're a very inspiring person. I'm not going to ask you the traditional question that I ask everybody towards the end of the podcast. I'm going to actually ask you for something else. What advice would you give to the new generation? A lot of things are changing with artificial intelligence. It's changing the way we're doing medicine. It's changing the way where children are doing their homework in schools. People are approaching everything in life. So for the 20-year-old, the teenager, or even the 25-year-old who's just starting their career, what advice would you give them?
Well, enjoy this wave very much. I mean, if I talk with the friends, some scared about the development of AI and technology of biotech. Some of them ignore it. But I really encourage, especially the new generation, enjoy it. Enjoy the wave. and find what you are good at and what you could do and what you want to. If happen, it's all the same thing. Just do it. It is important for the young generation has no boundary, living at the edge, not in the background. Because that's the reason to be a human being.
Wonderful words. And with that, thank you so much
Thank you.
for joining me on today's episode. We really appreciate it. And please, the next time you're in Abu Dhabi, do let us know. And we look forward to hosting you again on the podcast.
Thank you. I will be the regular guest.
Really appreciate it.
Thank you very
Doctor.
much. Thank you.
Thank you for joining us on today's episode. See you on the next one.